So what kind of conditions can craniosacral really help?
Well, in regards to the infant, all the important stuff about being able to just, eat and digest and sleep. So a lot of people think they have a colicky baby. A colicky baby is one that's got a bellyache. They have a bellyache and they can't relax and they can't sleep. And a lot of times they even have trouble eating. So with the breastfeeding itself, a lot of times the jaw is very tight from birth and they can't even open their mouth enough or suck hard enough to really get the milk. And then also reflux. A lot of babies are getting reflux these days. And what that looks like when the baby has reflux is they're burping the milk back up after it's already entered the stomach. And they'll make faces like they're sour, they have sour in their mouth. A lot of parents don't know what that is. That's because the milk's not staying down. So sometimes those babies are overfeeding. Maybe the mom has a very, very fast letdown of the milk. The milk's coming too fast and the baby's really not able to manage what's coming to them. And they're overeating and then the milk's having to come back up. So we can help with that. In regards to the mother, the birth is a very difficult thing to go through for everybody. There's compressions for the baby's head, the cranial molding the baby has to go through, but then also the mother's body has to mold for the baby, and all of the major opening that has to happen, both in the soft tissue, but on the bony level. And that can leave a mother with all kinds of aches and pains that she didn't have before. And that could include a low back issue or any type of a back issue, sacrum issue, hip pain. All of these things are treatable. There is another aspect of becoming a parent that we don't really think about, and that is the deep overwhelm that hits us when we have this helpless little person who rarely sleeps more than 2 hours. And we're used to getting a full night's sleep. We have an attachment to how we want to have our birth, how we want it to all turn out. Many times that doesn't happen. We have a healthy baby, but the candles weren't lit and we weren't in the bathtub. We were on a hospital bed with other interventions involved. And this can leave a mom feeling very disappointed. And I know personally I've been through this. And what happened for me was I had a very difficult time bonding with my first daughter because our birth was not what I had planned. And there was a part of me that was emptied, that feeling. Instead of being elated to see my child, I was depleted by the time she came out. And it took a long time for me to develop that bond with her. And I know it had an effect on her as well. She was healthy, she was breastfeeding, but there was an emotional impact that had on us. I see this a lot with moms, and I can help you with that.